So it's my real pleasure to introduce, I'm going to introduce both of you, just from the top, two good friends of the Ontario Health Coalition. First, Shrybman. Stephen is a lawyer, a partner in the law firm Sacco Black Mitchell. And he does public interest law, and he's done some of the most important cases in Canada in recent years. He did the Monsanto case that went to the Supreme Court. That was the one where the farmer took on Monsanto from the seeds that have blown into his field. The charter challenge, the current charter challenge in British Columbia against public Medicare brought by the private clinics. He did the Supreme Court case on enforcement of the Canada Health Act with the federal government. He did the Hydro One case, which stopped the privatization of Hydro One in Ontario. He is just a truly impressive man, also a friend, and a wonderful speaker and thinker and contributor to issues of social justice and public interest in Canada. We're lucky to be friends with him, I think, in the Health Coalition, and lucky to have him here today. Second is Sean Meagher, and Sean also has a tremendous amount of experience and history. He's worked for cabinet ministers, he's worked on public interest groups, and as an advocate for the public interest for more than 30 years. He is the Executive Director of Canadian Doctors for Medicare, who are one of the interveners in the BC court challenge to bring down public Medicare that's been brought by the private clinic. So he's intervening on the public side, on the public interest side, against, we have light. There was an issue with the electrical panel this morning. There we are. And so really has taken Canadian Doctors for Medicare and really made it into, I mean, they were great before too, but really made it into a going concern that has had measurable impacts on policy in Canada, in Ontario and across Canada. Really, makes a concrete difference, wins concrete initiatives for our side, and is a really important ally. So it's my pleasure to introduce them. Stephen will speak first, and then Sean, and then after that we'll have questions and answers and discussion with everybody. So Stephen, come on up.
Good morning, everybody. Natalie was far too kind in her introduction. I finally figured out how to describe my legal practice after doing it for 30 years. So this is how I describe it now to young lawyers who want to do something similar. I say, I lose some very, very, very big cases. Actually, we don't always lose. We win, but from time to time. But sometimes you have no option but to resist and struggle, however long the odds are, and so we don't always win. I'm here because, for two reasons, or three reasons, I suppose, to talk to you about this Brian D. case in BC, but really because I take direction from smart and capable women, and Natalie told me to come. So that's one reason. The other is that I've become convinced over the last 2 or 3 years when I thought about it that we actually still have a robust universal health care system, by far the most important social program in the country, because of you, because of people like you and the commitment that you have to be in places like this on a Sunday morning and guarding the boundaries of Medicare. And fending off the assaults on the system that opportunists continue to present. Principal among them is this character in BC. He's a member of the college. He's a surgeon. His name is Brian Day. Probably most of you know about him. Sean's going to tell you much more about this fellow and the pernicious threat to Medicare that he represents. We represent the Canadian Doctors for Medicare and the BC Health Coalition in this constitutional challenge to Medicare that he's brought in BC, which at the moment is in hiatus. We're interveners in the case. We've actually used evidence, which is unusual for interveners to be given the opportunity to do. I'm going to try to explain why the case is so important for the future of Medicare, not just in British Columbia, but right across the country. It's going to be a little boring, I'm afraid, because I'm going to explain the legal context within which the case is playing out, which is what explains why it's so problematic. There's a political dimension to this, but a very, very important legal one as well. So what he's done in this case is to challenge the basic essential building blocks of the Medicare system, which, as you know, are set out in the Canada Health Act and require provincial governments to establish publicly funded health insurance plans that provide universal access to comprehensive care, and to ban extra billing and user charges. Because if you don't ban extra billing and user charges, that was the last addition to the Medicare framework. There's legislation in the 50s and the 60s. And one of the very last things that Pierre Trudeau does is bring forward the Canada Health Act in 1984. I think that happens I find this history kind of a little interesting. It happens in May or April. That September, Jake Epp is the Minister of Health. And it's almost the end of the modern era, the defeat of the Liberal government of that day. But the last thing he does is consolidate the various pieces, the socialized medicine pieces of hospitals and physicians, which happen at different times, bring them forward, bring them together in the Canada Health Act, and tack on extra billing and user charges, because without those constraints, people will simply, physicians will, and would-be queue jumpers will simply take advantage of the public infrastructure that's there to create hospitals and access to physician care, and then top up. Right? Pay a little extra, pay a user charge, pay an extra bill that a physician presents you, and you'll get better service. So those people, that economic elite, will be able to buy a whole other category of care, quicker service, perhaps better service, and do that with the benefit of a public subsidy, because the physicians in the hospitals will all benefit from the basic infrastructure of Medicare. So that's why you have this ban on extra billing and user charges, and private insurance. And what Dave's done is challenge those essential elements of the system. He wants to get rid of the ban on extra billing and user charges, and he wants to get rid of the ban on private insurance. So he would open the door to multi-tier care. That's the basic thrust of his case. And he's doing that by relying on the Canadian Charter of Rights and Freedoms to found his argument. Now, many of you, who knows how many of you will know about the Charter, or much about the Charter. I think a lot of Canadians might imagine that it's the instrument that kind of exists in Canadian law to promote equality and fairness. And in many ways, that's not true at all. To begin with, the Charter is really about constraining things that governments can do. It is not about what governments should or must do. So it's not about, there's nothing in the Charter that requires the Canadian government to establish a healthcare system, or to provide anybody in Canada with any measure of health care at all, or potable water, or any other public or social good. What it's about is preventing governments from interfering with your liberties, from discriminating against you, from interfering with your right to free speech and assembly. So those are all very important things to build into the constitutional framework of a country. But unlike countries like South Africa and some other countries around the world, our government has no obligation whatsoever to provide anybody with health care. So what Day has done is enlist the rules that constrain government activity to argue that the ban on extra billing user charges and private insurance is an interference with the right of Canadians under Section 7 of the Charter, which guarantees Canadians the right to life, liberty, and security of the person, and not to be deprived thereof by arbitrary government action. And what he's saying is that, well, when you don't provide people with timely care, you keep them waiting on wait lists, and they're uncomfortable or they're suffering waiting for care, and then prevent them from buying that care when they choose to, and if they can afford to, you're interfering with their charter right under Section 7. So that's the argument that he's making. And that's the same argument that the Supreme Court of Canada considered in the Chowley case. I don't know, have people here heard about the Chowley case? A few of you have. It's a similar case. It came to the Supreme Court of Canada from Quebec. It was a doctor who had a patient who had a hip that he didn't get treated as quickly as he thought he was entitled to. The Quebec courts threw it out. There was really no basis for it at all, either in fact or in law, but the Supreme Court decided to hear it and actually granted him some relief, though it gets a little complicated because the majority of the court found that indeed this constraint on private insurance, which is what Chowley was targeting, offended the Quebec Charter of Rights and Freedoms. But the court was split on the Canadian Charter. So legally, the case had no impact on the framework of Medicare across the country, just in Quebec. And it only targeted private insurance. So along comes Day. His target now is the Canadian Charter of Rights and Freedoms. And he's not just going after private insurance, but he's going after user charges and extra billing. And the reason that's a profound difference, because you can really, not all Canadian provinces ban private insurance, and I'm not sure that it's necessary even in wealthier provinces where arguably private insurance plays a greater role, because there just isn't a private market for healthcare. There just isn't a big enough private market for healthcare. There aren't enough people who are willing to pay for healthcare that they can get subsidized or get for free in the public system. If they were to win this case, it would get rid of user charges, get rid of extra billing, get rid of private insurance. And because those essential features are the essential foundations of healthcare law right across the country, it would grievously wound the essential elements of Medicare, and what would be unconstitutional under the Protection of Medicare Act in BC would be unconstitutional under healthcare statutes right across the country that engendered the very same elements as all provincial healthcare systems do. So that's why legally the case is so problematic. Were he to succeed, it would basically undo the things that Medicare depends on in order to continue. The case would be appealed. I think either way it might go, and then appealed again to the Supreme Court of Canada. And some have taken the view that, well, the Supreme Court of Canada now is populated by a majority of justices appointed by Stephen Harper. He's systematically appointed judges from one end of this country to the other. He didn't start doing that with the majority government. He started doing that in 2006. So these are the people that are going to be deciding the environmental disputes and the public health care disputes and the other disputes that come before the courts in the years to come. The problem with waiting for the Supreme Court of Canada to get this case, if it ever gets there, is that if we lose at any level, we've seen in a way, the communications apparatus or the propaganda machinery of the privatization industry at work in consequence of the Chowley case, which really only was relevant to the healthcare systems in Quebec, and then only in a limited way. If we lost at any level, that industry would be knocking on the door of health ministers from one end of the country to the other saying, look, we told you so. We now have a decision from the court that these constraints are unnecessary, they offend the rights of Canadians. Come on. We have a private clinic or 2 or 3 or 20 we'd like to open in your province. If you open the door to private insurance, though this isn't going to happen overnight, if the private insurance industry, which exists in Canada, often the same companies integrated in North America, right? They're providing much more insurance in the States than they are here. But once they get in, you can't get them out. Their rights under NAFTA entitle them to sue governments if the governments do anything to kind of constrain the profitability of their operations. You see what happens when you've got an entrenched economic interest in the healthcare system, in the struggle that progressive forces in the United States have waged unsuccessfully to establish something resembling a single-payer system. We have, with probably only the exception of tobacco, been unable to move any agenda against established corporate interest in the last 30 years since really the dawn of neoliberalism. That's why greenhouse gas emissions continue to go up every year. That's why we no longer regulate toxics in any effective way. We've simply, disempowered the state, and it does not have the capacity to take on a vested, established, entrenched corporate interest. In a way, Medicare endures because we don't have the lobby, that comes with corporations having more of a stake in our public system. So you can't be sanguine about letting this case kind of lie until it gets to the Supreme Court of Canada level. And we intervened in part to make sure that there was a complete evidentiary record before the court, because you can't add to it as the case goes up through the system. And we have an affidavit evidence from David Himmelstein, who's the head of the U.S. docs, promoting single payer. Just a wonderful affidavit explaining how problematic the absence of universal care is in the United States, and also explaining what life is like for physicians in the U.S. when they have to deal with, half a dozen insurance companies and HMOs and navigate the complexities of making sure that the bills go in the right direction, and how that substantially increases the costs of practice and the administrative costs of the system, which, as you know, are one of the key reasons why the U.S. system is about 50% more expensive, I think, than the norm among OECD countries. So I think I've described the case and why it's so critical that we succeed in it. The province did a very good job speaking to us and being very open about the way it went about its defense, certainly soliciting from us recommendations in terms of who would be good to have as witnesses to rebut Dave's arguments. I think there are 25 experts that the province has called, including some of ours. The court would let us have Scott Sinclair give evidence about NAFTA, for example. He's an expert in our community on that subject. So the province took that on and had him give an affidavit. So they've got a very robust defense. And on the very eve of trial, and I think Dave's strategy was to try Medicare on the basis of anecdote, not evidence. I mean, the evidence is clearly against it. When you open the door to multi-tier care, you do nothing to improve the system. For most people that are going to rely on it, in fact, it's going to deteriorate. There are going to be fewer resources in the public system. There's going to be less political support for it, less confidence in it. It's going to make wait lists longer for those who depend on Medicare. So it's not, there's no rational basis for deciding in Dave's favor. But I think what he wanted to do was to have a kind of a circus or try the system by anecdote, by bringing forward people who had fallen through the cracks, often because their own physicians were negligent or neglected them, or didn't advise them properly about where they could get timely care, exploited their vulnerabilities in order to, feather their own nest. But one after the other, these people would come forward, and some of them damaged, some of them injured, and you can just imagine the way in which the media would eat up those stories. It's of no interest to tell a story, or very little interest, to people who are dealt with successfully every day in the public healthcare system. But if it bleeds, it leads when it comes to media stories. Most of you won't know, I lived in British Columbia for 3 years, how incredibly conservative the media environment is out there. Really, if you think it's bad here, it's really relentless out there. So, I just shuddered at the thought of this playing out day after day after day in the media as he trotted out the ostensible victims of Medicare. But at the very last minute, I think about a week before we were to go to trial, which was supposed to be a 24-week trial, which is completely crazy, he kind of called uncle, or we think he did. He said, his lawyers came forward and said, well, we think we may be able to resolve this. And let's not go to trial now, let's have an adjournment for 6 months. I think Sean will tell you more about that and the campaign that's ensued at this point, because we're very worried about and being able to cut a deal with the province, and the province backsliding on this, the province did put up a spirited defense, but when you give the lawyers kind of their free rein with this and a decent budget, they'll do a good job. They'll try to defend Medicare. At the political level, we're not so sure. And we think that Days has relationships with people at a political level in the province, and they would either agree with him, or they certainly want this to go away because it's a political problem for them. So we need to be very vigilant to hold the province's feet to the fire, that they not give ground to this guy. At the same time, I'll be very, very happy if this case doesn't go forward. It's just too dangerous. On the merits, it should fail. But so should challenge. And taking my chance with a court filled with Harper appointees is something I'd rather not do when it comes to Medicare. I'd rather play offense against these thugs rather than defense. And so I hope the case settles. And that's, I think, all I have to say, other than to thank you again for being here. I do think that, you have to imagine where we would be if it wasn't for you and the vigilant attention you have expressed to defending Medicare. You can just, without these meetings, without this resistance, you can imagine these opportunists biting off pieces of the system over the last dozen or 15 years. You have to remember that whole debate with, that gave rise to Rona, there was Kirby. Those people would have made progress. Who knows how much in any given instance, but at a certain point, things would have become, unraveled to a degree that kind of, you wake up 10 years later and you wonder, geez, we don't have Medicare anymore. How did that happen? Well, it would have happened, I think, but for the attention and the defense of the system, that really people at the grassroots. It's also happened because the public healthcare system is robust, and I think it's resisted change. I do think that the difference is that we still have a robust Medicare system, and we wouldn't have it but for the efforts you have made. So thank you very much for continuing to do that.
Thanks. I always hate following Steve at the mic for that reason. I'm Sean Meagher. I work with Canadian Doctors for Medicare, and I want to thank Natalie and the OHC, and second Steve's comment, thank you folks for the work that you do. The playing field that the fight over Medicare takes place on is occupied on one side by some people I want to talk a little bit about, and on the other side by people like the folks in this room. And without our side, the other side, those opportunities that Steve mentioned, would have a pretty open field. And I want to talk to you about a couple of them. I want to start by talking about Brian Day. Some of you probably know Brian Day. Some of you probably have heard his nickname, Dr. Prophet. Brian Day is the guy who says that The rules that mean sicker people get seen in hospitals before richer people belong in communist China. Let's compare our healthcare system to that of North Korea. He was a poster child for the Tea Party during the fight against Obamacare. This is a guy who actually said he doesn't mind being compared to Darth Vader because in his view, Darth Vader is really one of the good guys. So that's who we're fighting against. That's the kind of people who are in the field. And to know Brian Day, you have to know a little bit about the way he operates on a regular basis. Brian Day runs the Canby Surgical Center, which is owned by the Canby Surgical Corporation. And the Canby Surgical Center, since its 9,000 square foot expansion in 2003, is now one of the biggest hospitals in British Columbia, 6 operating theaters, 60 doctors practicing a dozen disciplines. We're looking at a huge operation that generates millions and millions of dollars, and they're really interested in hanging on to that capacity. And those 60 surgeons that operate at the Canby Surgical Center, those 60 surgeons flip in and out of the public service. Sometimes they'll be operating at Vancouver General, and sometimes, because the money's better, they won't go to Vancouver General, they'll go over to Canby, and they'll deliver service there. And that's one of the reasons why wait times are long in British Columbia for surgeries, especially for elective orthopedic surgeries, is because the doctors are skipping out on the public system because there's money to be made at Canby, there's money to be made at other private clinics. And that's one of the really toxic things about the private clinic world, is it eats the resources that would normally go to people like you and me, and it saves them for people who can pay enough to jump the queue, whether they're sicker or not. And that's really fundamentally what's wrong with the private clinic world. And that was the problem of the Canby Clinic, but that wasn't really what they got caught for. What they got caught for was breaking the law by charging people in British Columbia for things that they should be able to get for free. They're insured by their version of OHIP, by the Medical Services Plan, and they're entitled to those services for free. And since 2001, patients of the Canby Surgical Clinic have been complaining to the government of British Columbia, saying, I got charged for something that was supposed to be free. How does that happen? This guy's taking my money and he's not supposed to. And the province of British Columbia did nothing in 2001, and they did nothing in 2002, or 2003, or 4, or 5, or 6, or 7, or 8, until the BC Nurses Union sued the province of British Columbia to insist that they actually enforce their own laws. The BC Nurses Union finally said, hey, Government of British Columbia, you actually have to do something about the laws that you've passed. And under pressure from Labour, the BC government finally turned to Brian Day and said, okay, it's a bit of a problem. We have all these complaints saying you're taking people's money illegally, that you're breaking the law, and we think that's a problem. We'd like to have a look at your books to see if you're doing this. Given what we've already seen of Brian Day and his moral character, what he said when confronted with the idea that he might be breaking the law was, too bad, I don't care. I'm not going to let you look at my books, even though you're the government of British Columbia and you're required by law to enforce the Medicare Protection Act. I'm not going to let you see anything. Not because he said, I'm not breaking the law. Not because he claimed to be innocent. In fact, he publicly admitted he was breaking all of those laws. He said, it's fine, I'm breaking the laws. You can't look at my books because you don't need the evidence. I'll give you the evidence, I'm breaking the law. And they said, well, you can't actually just say you're breaking the law and go ahead and keep breaking it. He said, oh no, yes I can, because I'm going to sue you under the charter. And that's when he launched the charter case. He likes to run around saying, there's a moral principle behind it. He's standing up for patients who need quicker access to care. He didn't stand up for patients who needed quicker access to care until it was going to cost him money. When the government of British Columbia said, we want to see your books, we want to see if you've taken money illegally from patients, then suddenly there was a moral principle in play. And that's who these guys are. These guys are business people. They are there to take money from people, and as much money as they can possibly get, and Brian Day is one of those guys. And so he launched a charter challenge against the whole Medicare system to avoid having to comply with the laws of British Columbia and stop taking money illegally from patients. That best defense is a good offense model kind of worked for him. In 2008, he fought with the province of British Columbia over whether he should have to show them his books, fought with the province of British Columbia over whether or not he should have to obey the law. And he managed to keep that fight going for a pretty long time. It took about 4 years before the province of British Columbia actually got to see the books. There were injunctions and challenges and appeals, and the next time somebody tells you that the private sector is trying to move into healthcare to bring in efficiency, get them to add up just the cost of all the time and money that got spent trying to get a look at Brian Day's books and find out whether the private sector is actually spending money terribly efficiently. But at the end of that, at the end of 4 years of wrangling and fighting, the province of British Columbia finally did get a look at Brian Day's books. Well, not all of Brian Day's books. They got a look at about a month's worth of Brian Day's books. And if you read the audit, it makes a great read because it opens by saying, well, it's not a perfect audit. Here are some of the things that didn't work out quite so well. So for instance, Brian Day never provided us with financial reports, and he wouldn't give us the ledgers. And a bunch of the records he gave us were actually incomplete. And they stopped issuing receipts for the money they were taking from patients 5 years ago, so we don't really have any of that information. Oh, and they destroyed some of the records that we were asking for, so we couldn't see those either. So it wasn't a perfect audit, but it was an audit to some extent, and they looked at about 30 days worth of billings from the Canby Clinic, and they point out that they did see some infractions of the laws of British Columbia. By some infractions, I don't mean 1 or 2, and I don't mean 10 or 20, and I don't even mean 50 or 60. Somewhere between 205 and 223 infractions of the law. We don't really know how many, because the imperfect records and the destroyed records make that hard to tell exactly, but somewhere in the low 200 violations in a month they found in that audit. And in the process of those 200 odd violations, they found a fair amount of money changing hands that shouldn't have. And by a fair amount of money, I don't mean 10 or 20 bucks. I mean roughly $500,000 in a month. $491,000 was billed illegally by the Canby Clinic to patients in 1 month. And it wasn't just that they were taking money from patients. That wasn't enough of an infraction. They also were sometimes billing patients and also billing the province of British Columbia for the same procedure. In fact, in a month, $66,000 worth of double billing, or overlapping billing as they call it in BC, Brian Day was engaged in. That's the kind of work that was going on. And as Steve said, this guy, if he wins his case, will be wanting to bring this kind of service. And his colleagues in the private clinic world will be wanting to bring this kind of service all across the country. Billings to people that overlap, billings to people that cross the boundaries of what we now know as the law. That's the basis of this court case. And so CDM, Canadian Doctors for Medicare, decided that this is one of the places where we really had to draw a line in the sand. As an organization that speaks out for our healthcare system, as an organization of physicians who speak out for our healthcare system, having a physician challenge the fundamental basis of delivering care based on need rather than wealth was something that we really had to stand up for. And as an evidence-based organization, as an organization that believes that we should be standing up for a healthcare system that's based on what the facts tell us. Doctors shouldn't prescribe things unless they know they're good for you. And what we know from all the research all around the world is that the best healthcare system for patients that produces the best outcomes, that produces it for the most people, is a public single-payer healthcare system, and that evidence needs to be in front of the court. Because the evidence that doctors like Brian Day are bringing, doctors who claim to speak for the world of physicians and don't, is misleading to the public. The reality is that the people in this room are standing up for healthcare in a way that the doctors like Brian Day are not. And as Steve said, if Brian Day wins his case, it does throw every province's healthcare system into limbo. That if the Constitution of Canada doesn't support the Medicare Protection Act in BC, and it doesn't support the Medicare Protection Act in Nova Scotia, it doesn't support the Protection of Healthcare Act in Ontario, and all those acts get thrown into limbo, and all of a sudden it's open season. And the US healthcare giants are just dying to come into Canada and set up shop, and this creates enough ambiguity that they could. And once they're here, they're hard to get out. They're not just hard to get out because they are, bar none, the most successful political lobby on the planet, and they are. What they were able to do to the committed federal government of the United States that was trying to bring in healthcare demonstrates to you how good they are at lobbying and applying political pressure. Once they're here, they're very hard to get to leave, and it's not really clear under NAFTA whether we're even allowed to make them leave once they're here. So there are a lot of risks to losing that case, and having Brian Day step back to finally blink in that process just in early September to say, you know what, maybe we can work this out, was really helpful, because it is a dangerous case to have to fight But there is still a lot of danger, because right now Brian Day is not in court fighting with us in open court about the future of healthcare. He's behind closed doors with the Christy Clark government trying to figure out the future of healthcare.
Why isn't he in jail?
and he's not on his way to jail, which would be nice. And that's a scary prospect, because open court, you can see what's going on. Right now, we can't see what's going on. And so the BC Health Coalition, along with support from the Canadian Health Coalition, the Ontario Health Coalition, coalitions all across the country, have been calling out to the BC government to say, there need to be some kind of standards for how you negotiate a deal like this. You're negotiating with a guy who broke the law, so certainly we need to make sure that the law stops getting broken. And this guy broke the law. There should be some kind of penalty for breaking the law. He's taking in $491 million, $1,000 a month by breaking the law. That shouldn't be okay. And there need to be some standards set for how that negotiation works in BC, and we're calling on people all across the country to support those standards, in part because whatever goes ahead in BC becomes the new baseline all across the country. Don't think that if Brian Day negotiates an advantageous circumstance for private clinics in British Columbia, the province of Alberta is going to be very far behind. Don't think that Brad Wall, who's sitting there in Saskatchewan trying to decide if he's going to open up the MRI system to private competition in his throne speech next week, isn't going to be watching this and listening for an opportunity to open up the system to private clinics. And don't think there aren't people right here in Ontario who are watching. Because you don't have to look all the way to the Pacific coast to find very, very dangerous people in the private healthcare system. You can stay right here in Ontario. How many people here remember the Shouldice Clinic purchase?
Yeah.
Anybody remember who was the buyer? A little company called Centric Health that nobody had ever noticed before. Partly because it didn't exist before, because a few months earlier it had been Allegro Health. But they changed their name and repackaged themselves because they became the Canadian arm of a global US-based multinational called Global Healthcare Investments and Solutions, GHIS. And GHIS is a huge venture capital firm that pumps money into healthcare operations for massive, massive returns, and they're run by a guy named Jack Chevelle. Jack Chevelle got pretty famous in the international healthcare world because he took over a tiny little health service corporation in South Africa called Medicare, and he grew it into the third largest global healthcare firm on the planet. It is a massive, massive organization, but that isn't actually why Jack Chevelle stands out in the healthcare world. He stands out in the healthcare world because he takes, let's call it an unorthodox approach to healthcare. First, getting notoriety in South African papers for, and I'm not kidding about this, you can't make this stuff up, holding lotteries for breast enhancements where women can buy a ticket and possibly win a chance to go to one of his private clinics and get a breast enhancement. That was where he first popped onto the scene in his wonderfully ethical approach to healthcare. Medicare, though, stood out in South African politics far more a couple years after Jack Chevelle left the firm, when they admitted to 91 counts of trafficking in human organs in the South African courts. These are not nice people. And Jack Chevelle is the executive chair of Centric Health. He's the guy who is bidding on opening private clinics here in Ontario. His approach globally has always been expansionistic, rapidly expansionistic. But he's not the day-to-day boss at Centric Health. No, the day-to-day boss at Centric Health is a guy named David Cutler. He's the CEO, and David Cutler left his old job as CEO of Leisure World to run Centric. And I don't know how many of you know Leisure World, but under David Cutler's tenure, Leisure World was under, the Toronto Star General describes it as an abnormally large number of violations under the Nursing Home Act. Enough violations that they were cited for what the government of Ontario called an unexpected death due to regulatory violations. They actually put one of their nursing homes under constraints so that they weren't allowed to admit any more residents because of the practices they were engaged in. And to all of that, what David Cutler said was, you'll recognize this, any of you who live in Toronto and know our mayor well, he said, "We're not perfect." So Day's campaign to free up the world from more private clinics isn't an isolated BC phenomenon, and the almost cartoonesque caricatures of the kinds of evil docs who are stepping in to run our healthcare system aren't people that we have to look all the way out to BC to find. And in BC and Ontario, if the private clinic folks get their way, they're the people who are going to be occupying the other side of the playing field from the people in this room. So I want to thank everybody who's here. I want to thank the OHC and the other health coalitions, and all the partners who are active this weekend and all the time on this stuff, who are fighting to save our healthcare system from people who clearly aren't fit to run it.